do. The group has a mission. Go to Scotland and find that big boy. That's their motto.
Nellie, right? Isn't that the name of the Loch Ness Monster?
Good morning, everyone. Thank you for coming today. Before we start the public hearing, we just have a very brief regular board meeting to hold. This will only take a few minutes. I also wanted to mention that our newest board member, Dr. George Abraham, had a conflict which he could not resolve, so he could not be here today. But he will be reviewing the replay of the public hearing so that he knows everything that goes on. So I would like to call the regular meeting to order. And our first item on the agenda is review and approval of the minutes from the June 21st, 2019 Board of Health meeting. Had a chance to review the meeting minutes?
Yes, I have.
Any questions, comments?
Nope, they look good to me.
Okay, so do I have a motion to approve the meeting minutes?
Yes.
I second. All in favor signify by saying aye.
Aye.
Aye. So approved. The next item on the agenda is to review and act on the report from the Central Massachusetts Regional Public Health Alliance. Since we don't have any members of the Alliance here to report to us today, we basically don't have a report from them, so that basically takes care of the meeting. So the last item is review the meeting schedule. Are you able to, Jenny, come up with a date for the next meeting, probably in August?
Yeah. The week of the 19th or the 26th works for me.
Okay, I cannot do the 23rd, but I could do the 30th.
Okay.
Okay?
Yeah.
So let's make it tentatively August 30th, pending Dr. Abraham's availability, because I would like him to definitely be available, because that will be the time on which we decide on the tobacco regulation issue. Okay, so do I have a motion to adjourn?
Yes.
Second, all in favor signify by saying aye.
Aye.
Aye, so adjourned. Okay, so before we start the public hearing, I have an introductory statement to make. This public hearing is to discuss proposed tobacco control regulations for the town of Shrewsbury. Copies of the proposal have been made available to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. The Town of Shrewsbury Board of Health has a three-member board. The purpose of the board is to promote and protect the public health for the citizens of the Town of Shrewsbury. They derive their authority from the Massachusetts legislature. The members are Stephen Vigent, Jenny Fishman, and the newest member, Dr. George Abraham. The City of Worcester Division of Public Health is the health agent for the Town of Shrewsbury, a member of the Central Mass Regional Public Health Alliance. The duties of a health agent are to carry out the wishes of the board, assist in the enforcement of their regulations, and deal with day-to-day operations of the Board of Health. It is uncommon for the Board of Health to hold public hearings on proposals before them, even though all proposals are dealt with at meetings to which the public is always invited. However, because of the broad interest in tobacco control, every effort has been made to provide a public forum for the exchange and ideas of views. As the purpose of the public hearing is to collect information and opinions, the board will not ask for a vote from the audience, nor will the board itself vote on the proposal at this public hearing. The board will announce the meeting date to which they will discuss and vote on the proposal. The meeting will be public. However, the board will not provide time for further public testimony unless a board member has a specific question to which an audience member can offer some clarification. After the public hearing, the board will accept written testimony for a period of 8 days until August 3rd, 2019. Letters can be mailed to the Board of Health at the Richard D. Carney Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. If the proposal is passed, the approved regulation will be posted at the Board of Health office and will be publicized in summary form in the Worcester Telegram and Gazette with 1 week of passage. At this, I would like to call the public hearing to order, and welcome to the Shrewsbury Board of Public Health hearing to discuss a proposal to the tobacco regulations. We appreciate you taking the time to be here today. A copy of the regulation is available at the Board of Health at the Richard D. County Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. In the interest of time, we ask you to adhere to the following ground rules. Any person wishing to make comments should sign in, as you saw coming into the room. Before addressing the Board of Health, you must have read the proposal. When addressing the Board of Health, you must first identify yourself by name, address, and any professional affiliation you may have that impacts your comments. Identify the section of the proposal that you wish to comment on, and please limit your comments to 2 minutes so that other members of the audience may have a chance to speak, but I may increase that depending on the number of people who wish to speak. Please be considerate of those persons speaking, whether you agree or disagree with them, and refrain from commenting out of turn. A written comment period for those who are unable to attend or do not wish to testify at the public hearing will be allowed. Written testimony will be accepted by the Board of Health until August 31st, 2019. Please send your comments to the Board of Health at the Richard D. County Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. Any person showing verbal disrespect to those speaking will be asked to leave the public hearing. And thank you for your cooperation. I just also want to mention that this specific item in the tobacco control regulations that we are here to discuss today have to do with the limitation of the sale of flavored tobacco products to adult-only stores. So at this point in time, I would like to open up the floor to anyone who would like to make a comment on the proposal. Representative Kane?
Good morning. Thank you very much for holding this public hearing today and letting us provide comment on the proposed regulations in front of you. As you know, this is an issue that I feel passionate about and did send you a letter months ago urging you to take a look at this issue again. I support the regulations that have been put in front of you, and I would urge you to pass them. I do also want to provide some perspective on why this is critically important, and I know that you have heard this, but last week at the State House, I sit on the Joint Committee on Public Health. I'm the ranking minority House member. We heard before us a bill to ban tobacco-flavored sales in the Commonwealth, and part of that, there was very compelling testimony on the status of use of youth in the Commonwealth on vaping and e-cigarettes. For every one adult in the Commonwealth who uses an e-cigarette, there are 6 youth users. This is not a product primarily intended or used by adults. It is created by an industry looking to secure dependent lifelong users. There is a lot of misinformation on the health consequences of vaping. Many people think vaping and e-cigarettes are harmless. The fact is that one Juul pod contains the same amount of nicotine, which can be consumed in a 20-minute cycle, as an entire pack of cigarettes. This is a public health epidemic that we're seeing in terms of the youth, and the long-term consequences to our youth are going to be extremely detrimental. I know that there is a significant pushback from, in particular, folks who are selling these products. One of the issues that we've heard is people saying that this is a very important cessation product for people who use combustible cigarettes. The reality is that this is not a cessation product. The reason it is not as approved by the FDA as a cessation product is because the industry went to court to prevent the FDA from taking a look at this. They do not want the FDA to review this because they do know what will happen when that happens, and it will become much more transparent to people about what is in these pods and what it is that it will do to the human body. I would really urge you to take the regulations as have been proposed and pass them. In the event that you are uncomfortable with some of the litigation that is going on right now relative to the mint, wintergreen, and menthol flavor, I would urge you to pass the regulations without those included, and for us to come back and take a look at that in the future as more evolves, particularly as the state takes a look at what's going on. 152 communities, I believe, in the Commonwealth have enacted some form of restriction on the sale. And I believe that the proposal in front of us to restrict this to adult-only establishments is the proper next step to go. Thank you.
Thank you. Thank you, Representative. Frick. Fritz.
Good morning, Sandra Fritz, 21 Pheasant Hill Drive, and I'm also the chair of the school committee. As part of our district's health curriculum, students are taught about the health risks associated with tobacco use, including vaping or e-cigarettes. However, teenagers today, like past generations, are going to be tempted to try cigarettes or any tobacco products. We know flavored tobacco products are available for purchase at local gas stations and convenience stores here in Shrewsbury. Parents in our district have expressed concerns about teenagers vaping and using e-cigarettes, particularly at the high school level. While I'm a member of the school committee, my most important role is a mother. And I recently attended a concert at Foxborough Stadium with a lot of people much younger than me. And I was really shocked about the number of young adults and teenagers using vapes. And most of them resembled the flash drive, the very small ones. And these devices are small enough to be put in pockets and easily carried to school, used in bathrooms and the like. I believe young adults should be provided with information to help them make wise choices. We need to provide them with proper facts regarding the harm of using tobacco products. Current marketing of flavored tobacco products aimed at young adults, in my opinion, is wrong. We also need to make sure tobacco products such as vapes and e-cigarettes are sold appropriately and in an adult setting. I ask that you pass regulation that allows flavored tobacco products to be sold in adult-only stores, such as retail tobacco stores, vape shops, and cigar bars. Thank you.
Thank you. Yes, go ahead.
Good morning. Thank you for holding this hearing today. I'm Christine Morey, Executive Director of Shrewsbury Youth and Family Services. The recent dramatic increase in youth tobacco use has been very well documented, and this alarming trend is clearly related to teen e-cigarette use as opposed to combustible cigarette use. Since 2011, the number of high school students reporting current e-cigarette use has increased from 1.5% to nearly 18%, and that's based on self-report. This is problematic for a number of reasons. A 2018 report from the National Academies of Sciences, Engineering, and Medicine concluded that there is substantial evidence that e-cigarette use increases risk of ever using combustible tobacco cigarettes among youth and young adults, suggesting that e-cigarette use itself is a risk factor, not simply just a correlation to combustible cigarette use. According to the National Institute on Drug Abuse, youth who vape are over 300% more likely to use cigarettes than those who do not. And in a 2015 report from the National Health Interview Survey states that 40% of young adults who use e-cigarettes every day or some days were never smokers before trying e-cigarettes. Clearly, we're facing a severe public health issue, not just nationally, but right here in Shrewsbury. While e-cigarettes may have fewer carcinogens than combustible cigarettes, they still contain nicotine. A recent study noted that only about 13% youth are actually aware of this fact. However, nicotine is a powerfully addictive substance. Many youth, and we see in our clinic, anecdotally, which is about 85% of the population we serve, report that they or their friends use 2 or more vape cartridges a day. So as we know, that's equal to 2 combustible packs of cigarettes. Adolescent brains, we know, are more likely to become addicted to substances, and use of nicotine through vaping can literally prime a teenager's brain for addiction to other substances. To curb this trend, it's critical that public health officials work to decrease e-cigarette use. There are a variety of public health responses that may be effective in doing this, but the simplest may be to limit access to those 18 or under. Youth high school students found that 43%, found that 43% of young people who ever used e-cigarettes tried them because of the appealing flavors. Of current users, over 80% of youth reported that using e-flavored cigarette cartridges. At a recent training delivered by SYSF to middle school students were able to identify countless flavors, including fruit, candy, even sugar-related cereals. So again, from Shrewsbury Youth and Family Services, we receive calls frequently, daily, from parents concerned about their teens' e-cigarette use, nicotine overdoses, and the use of other substances. So we again urge you to pass this regulation. Thank you.
Thank you. Selectman Cassidy?
Good morning, and thank you for holding this hearing. I am here not in my selectman role, but as a resident and as a parent, deeply concerned that we're reversing the progress that has been made over decades to keep nicotine out of the hands of our youth. Growing up, most of the adults around me smoked, and at some point during elementary school, we began learning about the dangers of cigarettes, the blackened lungs, the nicotine addiction, and the link to different cancers. And through the Great American Smokeout, I made it my mission to get my parents and my grandparents to stop smoking. We're now facing an eerily similar public health crisis among our youth that is far less visible. Juul and similar vape products are targeting young people with their sleek devices, Technicolor, pods, and fun fruit candy flavors. Vaping is quiet, odorless, and easy to hide from adults. Many parents either don't realize that their kids are vaping or are unaware that the liquid contained in the pretty little pod has as much nicotine as an entire pack of cigarettes, takes about 20 minutes to use, and that many kids report using 1 to 2 pods per day. Walk into any convenience store and vape products are widely available and highly visible with their bright colors and sleek packaging designed to entice young users and hook them for life. I believe it is time for Shrewsbury to join the other communities in the Commonwealth to restrict the sale of flavored tobacco products to over 21 retail establishments. I understand that due to pending litigation, we may be unable to restrict the sale of mint or menthol flavored tobacco products at this time. And it is my hope that our Board of Health can move ahead with regulations to restrict the sale of other flavored tobacco products now and revisit mint and menthol flavors once court cases have been resolved. I am not naive enough to believe that these restrictions will completely eliminate youth tobacco use in our community, but I'm hopeful that regulation will send a strong message to our young people that they may not realize that these products are dangerous, but the adults around them do, and that we are concerned that the exposure at a young age will lead to addiction and lifelong use. Yesterday, I took my 13-year-old daughter to her yearly physical, where her pediatrician asked her a number of questions about vaping or feeling pressured by her peers to vape. While I was glad that that conversation was happening, I also couldn't help but realize that 3 years prior, when I had taken my now 16-year-old daughter for her 13-year-old physical, that question wasn't even something that was discussed. So in just 3 short years, it's now something that pediatricians feel like they need to bring up during a yearly physical exam. She shared that she needs to learn about nicotine patches and ways to help parents manage nicotine addiction in their children. And just this morning, watching the news, there was a report of 12 teens, I think it was maybe Wisconsin, with severe lung damage from vaping. And it just seems that every day there's just more and more evidence of how serious this health crisis is for our young people. So I am asking for your support in passing these regulations and appreciate your time. Thank you.
Thank you. Yes?
Good morning. My name is Alex Sakara, and I serve as the headmaster at St. John's High School here in Shrewsbury. I'm a Worcester resident, but obviously have a vested interest in what happens here in the town of Shrewsbury, and we're grateful as an institution to be a partner with the town. I just want to speak briefly in support of the regulation that's being proposed and passing that regulation. I'm entering my 26th year in education, and I don't think I have seen such an acute and sort of sudden issue that schools, teachers, educators, families, students have had to deal with in that time. I want to bring the board's attention to an article that came out today in the New York Times, which talked about so I would invite the board to read that article, but I do want to read one portion of it. It talks about a House, a congressional subcommittee that's been meeting about the issues around vaping, and in particular the promotion by the company Juul to promote it amongst young people. And I'll read just one paragraph from the article. And I quote, "Juul deployed a sophisticated program to enter schools and convey its messaging directly to teenage children, recruited thousands of online influencers to market its vaping devices to youths, and targeted children as young as 8 in summer camps," and that's from a memo that was prepared by the subcommittee. So I'm very much in favor of limiting access to these devices. I think adults should have the ability to make decisions for themselves, but I think we as adults in working with our young people need to help and guide them in making their decisions. So I just wanted to speak this morning in support of passing this regulation. Thank you.
Thank you. Yes, over here.
Good morning. Thank you very much for holding this hearing. My name is Cheryl Sabara. I am the Senior Staff Attorney and Director of Policy and Law for the Massachusetts Association of Health Boards. We provide technical assistance and legal education to boards of health throughout the Commonwealth. My colleague, DJ Wilson, is usually before the board. I'm here in his stead. And I'd like to just give you an update on litigation that has been mentioned. The Public Health Advocacy Institute, which is at Northeastern Law School, is assisting the several municipalities that have been sued by, there are two plaintiffs basically. One is Cumberland Farms, and the other is the Coalition of Responsible Retailers members, who are individual stores. Just to put this in perspective, every motion for a preliminary injunction that Cumberland Farms and these retail stores have filed against the plaintiffs to date, they have lost, every single one. The judges have said consistently that they do not have a likelihood of success on the merits, that the regulation is a rational regulation, a reasonable regulation. So just so you know, we have a really outstanding track record so far in these cases. This is a classic industry strategy. It was done when you and all of your colleagues throughout Massachusetts started passing regulations regulating secondhand smoke. This was the strategy that they used. They sued and they sued and they sued until they got a decision from the Supreme Judicial Court in Massachusetts saying that boards of health had the legal authority to address tobacco control issues. And I would also make note of two other issues that previous speakers have mentioned. This regulation does not prohibit an adult from using an electronic cigarette. What it does is it prevents adults from having unfettered access to these products. We don't want to undo a quarter century worth of tobacco control efforts where we've been able to reduce youth smoking to such a low amount and then have these products come in and undo everything that we have all tried so hard to prevent. So again, this is not a prohibition, it's a restriction so that youth are not exposed or able to buy these products. Thank you.
Thank you.
Thank you.
Go ahead.
Good morning. My name is Jane Lazat. I am the Assistant Superintendent for Community Partnerships and Wellbeing here in Shrewsbury, Mass. And I'm joined by my colleagues John Kelly, the principal of Sherwood Middle School, and Ann Jones, the principal of Oak Middle School, because we strongly believe that we need to protect our children by advocating for their well-being. We often use the phrase in our schools, we're all in this together, we need to do the right thing. And doing the right thing is limiting and restricting the availability and the sale of these products because our children watch us very closely. We model what it is that we want them to do and not do, and we strongly believe that this is a community issue, and we also know that each one of us is here today because we feel strongly that our children need to be exposed to the best and the healthiest of environments and situations, and we ask that you do what those before me have asked, and that is to restrict the sale of these products in stores that are not stores intended for children. And we are their advocates, we're their moms, we're their dads, we are their neighbors, and we're here to protect them and to support them in making the right decisions, and we know that this is the right decision. So thank you for listening, and we look forward to further conversation.
Thank you. Go ahead.
Good morning.
Good morning.
My name is John Kelly. I'm a resident of Shrewsbury. I'm also a newly appointed principal at Sherwood Middle School. I served the last 6 years at Grafton High School as an assistant principal and had a lot of firsthand interaction with many high school students. And like Alex mentioned earlier, it's difficult to watch students, especially from my position where I had to consequence students for their actions. But in many of those occasions and conversations with students, it was apparent to me that it was really out of the students' control. They become so addicted to these products that no consequence that I was going to give a student, no matter how severe that was ultimately going to help them, make good choices, at least for a majority of those students. So I think, speaking and having really difficult conversations with students and parents over the last 6 years, what I learned as an administrator of high school students is that it's not starting in high school. I'm a parent of 3 children in town, and being a principal of a grade 5 through 6 school, that's where it's starting. And I think we need help as school leaders to make sure that the town, there's a partnership to ensure that these products are not readily available to our youth so that they can make those healthy choices and not, as they're moving up through the line and becoming adults, that they're not addicted to those products and it becomes a lifelong issue. So I would ask that you look at this issue and do whatever is in your best interest to support our children. Thank you.
Thank you.
Thank you.
Dr. McGee?
Morning. Dr. Dale McGee, 28 Oak Ridge Way, here in Shrewsbury. I am a retired physician, past Commissioner of Public Health for the City of Worcester, and member of the school committee. And I'm here to support the regulations that you're putting forward today. Particularly, I'm concerned about flavored products and the e-cigarette products. Flavors are marketed to and appeal most to youth. The idea that it's a marketing device and that the flavors appeal to everyone, I think, is false. Flavors like apple, cherry, chocolate, bubblegum, candy, toffee are not designed to appeal to adults. They do appeal to children. And meanwhile, a survey of the shelves of a local convenience store revealed that over half of the shelf space that was devoted to cigars was flavored. So clearly these are a big portion of the vending that occurs there, particularly with those products. For new users, tobacco smoke is appropriately very irritating. The body is telling them they don't want to inhale this toxin. And flavors in general, but menthol in particular, dull their senses, dull this reflex, allow them to inhale more deeply so that they can become more rapidly addicted to the nicotine, and so that they can do damage more deeply into their respiratory system. So these are particularly toxic that way. Nationally, as you know, a large majority of the younger group started smoking with flavored products. And we have the ability here in Shrewsbury to survey our students, both in the middle school and the high school every year, about a number of things, among them are nicotine products. And what I know from the results of that survey is that while cigarette smoking is going down, and this is laudable, this is more than being made up for by the uptake of e-cigarettes and flavored products. Most of the students who are moving towards nicotine products are starting with flavored products here in Shrewsbury, and a significant percentage of the students do not feel that this represents a health risk. They have not been well educated to this risk. So these are important portions of this. I think that the other piece here is that when we ask the students how they get their cigarettes, the overwhelming majority have somebody else get them for them. They get it from a friend, a parent gives it to them, they give someone else the money. So simply having a regulation that says you have to sell only to people over 21 isn't adequate, because the vast majority of people are basically having someone else make the purchase for them. So we need to be aware of that. We need to make it more difficult to access these things. And as I say, harm is being done by these flavored products. It's not just the appeal, it is the fact that it can more rapidly get them addicted to this product. So I support this regulation and hope that you pass it. Thank you.
Thank you. Anyone else like to comment? Oh, wait.
Hello, thank you for having this today. My name is DJ Orr. I'm Director of Operations for Colbia Enterprises, or the opposing view of everybody else in the room. I'd like to start out by saying what we are not. What we are not in the convenience store industry is tobacco. Okay, we're not a tobacco company. We're not marketing towards kids. I'd also like to stipulate that pretty much 100% of what I heard today, I agree with, personally, as a father and as somebody who lives in the community and understands that we have an epidemic in our schools. What I'm opposing is that it is your business people, your partners' fault for this, okay? There are, the previous speaker, a doctor, which I also agree with, mentioned that 80% of the youth get this through somebody they're associated with. Your business partners, your community, who we are is, you know, we employ your children. We employ your parents. We employ many workers that are selling milk, bread, and eggs, gas, as well as tobacco product to legal adults. That's what I'm here to say to you today, that you're representing an epidemic that we have going on. You have to solve this problem, but you also are representing legal adults who have the right to choose for themselves in our stores, okay? I'm personally opposed to tobacco. Neither of my kids smoke or jewel or any of that. I'm proud of that. But my argument here is that you can't educate through legislation, all right, from my personal view. And to blame your retailers who have, I think, come up to speed, spent money, time, energy to put equipment in place to guarantee, because the Board of Health is very tough in every community as far as selling to underage. You know from your own statistics that your business partners sell to adults. Those adults turn around and give it to children is an educational issue, not a point of sale issue. To the argument that I heard today about us marketing the product in plain view, that is accurate. But I'm here today to tell you that I'll work with any community that wants to say, all right, get it out of plain view. Take your signs down. Let's deal with the educational perspective of all this, as opposed to blaming hardworking people, businesses in your community that, let's make no mistake, I represent a company that has, operates in 4 different states. Legislation like this will not kill my company, all right? Legislation like this may very well close the doors of some of the single operators, which is at 80% of operators in mom and pop shops around the store. So I'm speaking on behalf of myself, but I'm speaking in behalf of the mom and pops around here that are going to mean jobs, going to mean businesses being closed, revenue as far as taxes are being closed. This is not just a business harm. We have a serious problem faced in front of us, and I do not want to represent the industry saying, listen, don't go this way because it'll financially affect us. My proposal to you, my consideration, my plea to you is don't go this way because it is blaming a group of partners for you that are trying the best they can, spending time, money, and effort on this, and actually probably has a better rating as far as compliance, successful compliance, than even the age-restricted items or stores that you have in your town right now. You have those numbers. You can review that for yourself. But we train our people at length. We verify almost every day with our video equipments that we apply in the stores. We are selling to adults, pure and simple. Are mistakes sometimes made? Yes, but that is not the epidemic we're talking about right now. What we're talking about right now is the kids going on the internet, the kids getting their jewels from adults that are giving it to them. It's an educational concern, and it's also a concern that we are, from my view, this is just my view, personal view at this point in time, we are 1 out of 5 states in the union that cannot legally hold kids accountable if a 13-year-old decides to smoke a jewel in front of a police station. There's nothing anybody's going to do about that except go to that kid and say, where did you buy that? And hold me, the retailer, responsible for that. That is wrong, in my opinion. Okay, so thank you for having the opportunity to speak with you, but I just wanted to give the other perspective for a little bit. Okay?
Thank you.
Thank you.
Anyone else? Sure, go ahead.
Morning.
Morning.
My name is Tina Grasowski. I coordinate the Central Mass Tobacco-Free Community Partnership out of UMass Medical School. Thank you for taking up the issue today and paying attention to this important topic. I have a couple points I'd like to share with you. The Tobacco-Free Community Partnerships provides education and awareness around tobacco industry tactics and tobacco prevention. We hope to reduce smoking and secondhand smoke. I was really glad to hear the select woman say that her child's pediatrician is now asking questions about Jewel, because that's the education that we provide to pediatricians, so that was good to hear. Regarding the business aspect of this issue, I was glad to hear you open your board meeting today saying that the reason for the Board of Health is to look at the health issues for the town, not the business interests of the town. No store in Massachusetts has closed because of this regulation. And although one of the tactics of the industry is to threaten store closures, no stores have actually ever closed. Just 2 weeks ago, I was in the 7-Eleven store here in Shrewsbury at the counter, looking at the products behind the counter. You may have heard that the Juul industry, the Juul company in the tobacco vaping industry, pulled all their flavored products from the shelves at the request of the FDA, and they didn't do that until the FDA requested them to do that. However, in the stores now is a new product. One of them is called Fruit. It's spelled in a iconic way as if it was a product from IKEA. So F-R-Y-U-T. And it's labeled Juul compatible. And they are fruit flavored, grape, cherry, etc. So although the Juul company has removed their products, other companies, and they may be associated with Juul, I don't know, have moved in and are now selling those products in the store. So once again, we cannot rely on the industry to be thinking about the health of the young people of Shrewsbury. Also, we need to be forward-looking, again, because new products are coming on the market all the time. I first heard of the Juul in 2016 from a Shrewsbury High School student. That was 3 years ago. And when I first heard the word Juul, and I work in the field, I was really confused. What is this young man talking about? A Juul device on an e-cigarette, like a sparkly device, a Juul case? And then, of course, we began to learn what these products actually were. So you may have heard that the FDA now has approved a product that's called Heat Not Burn, IQOS. I quit ordinary smoking. These products heat tobacco so that the nicotine is released but is not burned. They've approved it for sale without, scientific results of the products, either short-term or long-term. As some of your people have spoken already, we know now the short-term effects of these Juul products and the electronic cigarettes, and we don't know the long-term effects because they haven't been around long enough. So, as the Board of Health, I really commend you for taking up this issue, like the other 150 communities in Massachusetts that have done so. And because of that, the state, as Representative Kane said, is looking at this issue. But it's imperative that each town pass this as a regulation from the board so that the state can see that the population is interested in this restriction, that it's imperative for the health of the youth. Thank you.
Thank you. Anyone else like to comment? Okay, seeing none. Before I close the hearing, I just want to mention again that the board will not be deciding this issue today. It will be deciding it at its next meeting, which we have tentatively scheduled for August 30th, at which time the board will discuss and decide. Basically, the options are to do nothing, approve or adopt the regulation as proposed, or adopt the regulation with amendments. As an example, excluding the menthol, mint, and wintergreen flavors from the definition of flavor. So at this point in time, unless you have any comments, questions, do I have a motion to close the hearing?
Yes.
Second, all in favor signify by saying aye.
Aye.
Aye. So we're closed. Thank you all for coming.
Thank you.